Welcome to Jaw Talk. I'm Dr. Tiffany Lamberton, and in today's episode, I'm thrilled to have Dr. Alayna Schoblaske with me. Dr. Schoblaske is not just an accomplished dentist and dental director at La Clinica in Southern Oregon. She's a beacon of inspiration for health equity, a leader in dental education, and she's a passionate advocate for the dental community. From her prestigious education at Oregon Health and Science University to her invaluable contributions to organized dentistry, Dr. Schoblaske is here to share her insights on a range of compelling topics, including the empowerment of women in dentistry, the future of dental therapy, and the crucial role of fluoridated water in oral health. So I'm really excited for this episode because February 1 is going to be Dental Action Day in my home state of Washington State. So if you're a dentist, make sure you sign up for this through the Washington State Dental Association. This is such an important conversation ahead of the legislative session. So let's dive into a conversation that promises to be enlightening as well as engaging. Quick legal disclaimer. All information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider. Hey everybody, this is Dr. Tiffany of TMD Collective, and this is Jaw Talk with me. And I'm so excited about my guest, Alayna Schoblaske. I wanted to make sure I said your name right. Thank you so much for being on the show.
Thank you for having me. I'm excited to be here.
Yes. So you're a dentist. Tell us a little bit about who you are, what you're passionate about.
Absolutely. Yeah. My name's Alayna Schoblaske. I am a general dentist. I graduated from Oregon Health and Science University, OHSU, in Portland in 2017. And then I went on to do a GPR at the Washington, D.C. VA hospital. So popped to the East Coast for a year and then came back to Oregon, where I am now. And I practice in a federally qualified health center. So I practice in dental public health. I work in an awesome clinic with 7 other dentists and take care of patients that traditionally have had a harder time getting access to dental care, either because of language or cost or location or so many of these other factors. So I really love the work that I do there. My title is technically a dental director. So I spend 3 days a week seeing patients and then 1 day a week doing some administrative work to support our clinic. Outside of that, I am really involved at both the state and national level of organized dentistry. So I'm our state dental association, the Oregon Dental Association's editor. And so I get to work on our monthly member magazine and all of our other publications. And then at the national level, I am a member of the ADA New Dentist Committee. So that's a group of 17 new dentists, 10 years of school or 10 years out of school or less. And we just represent new dentists and dental students across the country and make sure that our profession is going in a direction that works for us and that we're really excited about.
I love that. And that was one of the reasons I wanted you to come on the show, because this episode is going to drop in January and February 1 is Dental Action Day. And so I am newer to organized dentistry. I mean, I did some in dental school, but then I took a big break from it. And then in about 2020, I think maybe right before the pandemic, one of the oral surgeons in my area kind of twisted my arm and was like, we need a board member for the Pierce County Dental Society, and I was like, oh, really?
Yeah.
So I'm newer to that, but I just did my first House of Delegates for the WSDA in September. And that was such an amazing experience to go and see. And so what was your experience? You got to do that at the ADA level.
I do.
What was that like for you?
It's really cool. It's really neat to see how individual members can really have an impact on what happens nationally. So you're totally right. I've gotten to go to our Oregon House of Delegates as well as the National House of Delegates. And I'm really big on the ADA likes to use all of these fancy words and nobody knows what they mean. So the House of Delegates, I always like to explain it that the ADA and your state dental association is a member-led organization. And so ultimately, we have all of these awesome staff members that help carry out the will and the vision of our members. And so we have staff members across the country, but they take our direction. And that direction comes from the leaders that you elect. So our national president, your state president, your national and state boards of trustees. But it also happens at this legislative body that gathers usually once a year, and that's called the House of Delegates. And so it's kind of like our US Congress. It's more like the US House of Representatives. So each geographic district, each state or each county has a certain number of representatives. We usually call them delegates based on the number of members in that area. So like in Washington, Seattle King County and Pierce County send the most representatives to the WSDA House of Delegates. I went to college in Tacoma, so I know the area kind of well. And nationally, like California and New York and Texas and Florida have a lot of representatives at our national ADA meetings because they're the biggest states. And so all of those delegates gather once a year and vote on the policies of the ADA or of their state organization. And those policies, this year, some examples were our policies on Medicaid, our policies on how we support our volunteers, our policies on, I'm blanking on some of the others, but I think there were 60 to 70 different policies that we've discussed and voted on. And every vote truly matters. And there is a process for testimony and discussion and debate that happens before every vote. So any member can get up and testify and share their perspective on the House floor. And truly any member, even if you're not a delegate, can submit written testimony and written perspective before the House of Delegates. And so, yeah, I've gotten to go to 5 ADA House of Delegates, 4 in person and 1 virtual. And thank you, 2020. And everyone has had its own flavor. It's been fun as a new dentist. I feel like every year I see more and more diverse perspectives standing up. So younger dentists, newer dentists, dentists in different practice modalities, FQHCs like me, or DSOs, or private practice, or academia, or military dentistry. It seems like there's getting to be more and more perspectives and points of view across the ADA, which is really cool.
That's so good because, one of the things that I hear is like the new dentist is like, oh, it's not worth it. The membership is so expensive. You kind of get this like pushback.
Totally.
Like, what do you say to that new dentist that gives you that kind of pushback?
It is expensive, and we're working on that. So this year there was actually a $60 dues decrease for the ADA dues for 2024. So it's our first ever dues decrease in my time and a member, and I think way longer than that. So that really speaks to the ADA. $60 is not that much, but it's a move in the right direction to say that the ADA is looking at the programs that we own and that we manage and saying what is most important and most effective for our members. And if it's not important or effective, maybe we don't need to fund it as much or at all. And so there's actually a membership restructuring system. There's a task force gathering and working, seems like around the clock. I think they work a lot to look at membership and say, like, maybe our current system of one flat rate for everyone is not the best system. Maybe we need to look at what members want in 2024 in the age of Amazon and Netflix and subscription services and a la carte systems. So I think that will be really exciting. The current plan is that a kind of draft of that new membership model will roll out in the middle of 2024 and then be active in January of 2025. So in the next year, there's going to be a ton of change of what ADA dues look like. So that's one thing that I say, kind of like stick with us, stay tuned. I think it's going to look more appealing in the next year. And the other thing that I say is that for me, the member value really became evident once I got involved. And that's when I understand, like, oh, here's what my dues are going to support. They're going to support an insurance advice line that members can call Monday to Friday, 8 to 5, and speak to insurance experts about claims questions that they have and problems that they're facing with third party payers. It goes to a library that archives all of the scientific research that we do in dentistry and gives members access to a librarian. I could call up right after this call and say, we're considering changing the composite that we use in our practice, and I want a summary of the tensile strength and bond strength of all of the composites on the market right now. And the ADA librarians could help me put together that report. It goes to our advocacy at the state and national levels. It takes money to make policy happen, whether we like it or not. That's the way our political system is set up. You got to have a seat at the table, and those seats cost money. And so our dues and our donations to like AdPAC and things like that help make sure that we have a seat at the table. But it also goes to like smaller local CE events. That's where I feel a lot of the fun is our local component, the Southern Oregon Dental Society, does a monthly CE talk. We have a local specialist come in and give a presentation for an hour, and we share dinner and we talk and we get to know each other. And so that would be my encouragement to new dentists or dentists of any age or experience, that if you've just been paying your ADA dues, thank you. And I would challenge you in 2024 to do something that you haven't done yet, to consider running for a leadership position locally, or to go to those CE events if you haven't normally done that, or to go to your state dental conference and take advantage of a membership discount there, or to send me a message or get in touch with your new dentist representative and say like, hey, where can I plug in? Where can I get involved? For me, that's when I've really seen the value. So that would be my response.
Yes.
Has it been the same for you? Seems like you've gotten more involved. Do you see the value more now that you're more involved?
Yeah, absolutely. Absolutely. Well, I mean, like one of the things as you were talking was like, I didn't even know about like the non-dues revenue of like something like the retro program that the WSDA is doing, or they're looking at like a new program that, may streamline like the OSHA WISHA training, so they have some of these programs that you're like, this is amazing, but you don't know until like you're kind of like stuck and you have like an L&I claim. And then you're like, oh, well, I have this free retro thing that will help me with this. So, I feel like I'm constantly learning the benefits, right?
There's also really fun benefits that like I learned recently, that if you ever go to Chicago, the ADA has a relationship with a couple of really nice Chicago hotels. So if you go even just for a family vacation, not related to ADA travel at all, you can stay at the Ritz-Carlton for like $250 a night. And I think,
I didn't know that either.
You get a discount on, there's some rental car discounts. You get a discount on all Hyatt hotels around the world. They have a company called AHI Travel that does like group trips and some like travel planning for folks, and members get a discount. ADA members get a discount. And then there's things like rate reductions on student loan financing. We just signed an agreement with Equitable Financial Advisors and GradFin. And so new grads can have a free 30-minute consultation to look at their student loan repayment options and get a plan together. So there's all sorts of benefits, even if you don't ever go to an in-person meeting.
Yes. Yeah. Well, and I love, you mentioned, the kind of local society meetings, and I'm going to be speaking in February for the
Congratulations.
Society Day. And like literally it's like $46, and then you get your CE credits, you know? So like, to your point, I invited a young dentist, and I was like, he had just graduated from dental school, and I was like, you can come one time and it's on me, and you can just see what it's like to just network with like the specialists in the area. You can, I'll introduce you to, our endodontists and our oral surgeons. And like, it's just a great, kind of down to earth meeting where you can start to network with the local society. So that's been really cool.
I feel the same way.
And then the Dental Action Day, that was amazing too. So I went to that last year, and it's so cool to you just go to Olympia and, start to talk with all of those issues that, for us, we've been kind of fighting the issue of like dental therapists. And I don't know if you guys have experienced that as well in Oregon, but, that was something that we talked about. The fluoridation of water was a big hot topic, which I was really shocked. And, I mean, some of these issues that you just think are like, everybody knows that, maybe not.
Yeah. Well, and
Could you speak to the fluoride issue? I feel like that is like,
oh gosh,
I mean, crazy how controversial that was.
Yes.
About taking it out of the community water.
Mm-hmm. Yeah, actually in Oregon, most of our water is not fluoridated. And as a public health dentist, I wish I could wave a wand and change that, because I would love for all of my patients to have access to fluoridated water. My first year of dental school, Multnomah County, which is where OHSU and Portland, Oregon is, had an initiative to fluoridate their community water supply. And so I was sort of plunged into this advocacy world. Exactly. And it didn't end up passing, unfortunately. But I got to see firsthand the importance of education and access to legislators. It was a ballot measure. So it was a community vote, not a legislative issue, and got to see how we could have impact on that. Oregon passed the General Practice Act to include dental therapists. And in that process, this was a couple of years ago, the seat at the table that the ODA had was so important in making sure that there were guidelines on that expansion. And so there was a lot of momentum in our state to move forward with this. It was a pretty foregone conclusion that dental therapists would be introduced in Oregon. There was a lot of political capital and desire to have that happen. But the original bill that was introduced was kind of like, if anyone has been trained as a dental therapist in any program at any point in any time, they can bring the scope that they were trained to practice with them to Oregon, and we'll honor that. And so it would have resulted in this mismatched jigsaw of scopes and of training and of backgrounds that would have been, frankly, just really confusing for dentists and for patients to not know what it meant to go see a dental therapist. Some could do extractions and some couldn't. Some could do SRPs and some couldn't. And so we were able to advocate to say, we want a consistent level of training and a consistent scope of practice. We want patients to know what a dental therapist is, and we want patients to know what to expect when they're receiving treatment by a dental therapist. And we want dental therapists to have completed a CODA accredited program, just like every other dental professional, licensed dental professional in the state. And so, everyone can have their own opinions on whether on dental therapy as a position, but I think that ODA's involvement in those discussions, having our lobbyists there every day, having conversations with legislators, meant that we were able to get a really clear and safe and consistent bill to pass through. Yeah.
Well, it just passed in Washington. I mean, after like 13 years of like battling.
A long time. Yeah.
Yeah. Well, and now it's like, being able to like restore implants is, a discussion that the WSDA is getting involved in with the dental therapist. Like, is that going to be part of their scope?
Oh, interesting.
Yeah. I mean, I don't know the ins and outs of that discussion as well as you do, but I know that that's being, brought up right now. Well, and another thing that I wanted to highlight is Dr. Linda Edgar was just appointed to the ADA president. So yay, women in dentistry.
Yes.
You got to hear her keynote address. What were some of the like hot takes from that?
Oh gosh, I love Linda. I look up to her so much. She's such a mentor for me. She's the reason that I'm on the new dentist committee, because she came to me and said, I think you could do this, and I think you would be a good representative for us. And so I'm just so excited for her to be in the president role. What stood out to me are two things. She is so much about collaboration. So she was a high school teacher before she became a dentist. And my mom is a high school teacher. My best friend is a high school teacher. My boyfriend is a high school teacher. I really like high school teachers. I surround myself with them. And I think teaching, education, and dentistry have so many natural overlaps. We meet people where we're at, we educate, we inform, and we help and serve, and we're there to build the knowledge and the skill of the people that we serve. And Linda's history as a teacher is so evident in everything that she does, because she's always thinking about, what do we want to teach? What do we want to educate on? And who do we need in the room? Whether that's a classroom or a boardroom, who do we need at the table to get that done? And so she's thinking about ways that we collaborate with other dental organizations. So the National Dental Association, the Hispanic Dental Association, the National Network for Oral Health Access, NOAA, the Academy of General Dentistry, the ADEA, American Dental Education Association, and dozens of others that I haven't mentioned. How do we collaborate with them? Because we all want the same thing for our profession and for our patients. So how do we collaborate with them? And then also, like, how do we think outside the box? So one of the things that she's doing is lessons in a lunchbox. And so this is a program that has been going on for a long time, where dental students mostly go into, I think, second and third grade classrooms and talk about oral hygiene, but also talk about what it's like to be a dentist. So to tell these kids, like, you can be a dentist. I'm a dentist and you can be one too. And also, here's how to take care of your teeth. And so Linda's been working with that organization, because we know that workforce is such a big deal. And so, of course, she's thinking about things that we can do in the next year or the next 2 years to address workforce. And she's also thinking about, what does our pipeline of future dentists look like 20 years from now? How do we make sure we still have a good, strong pipeline of dentists? She is also so much about action. So she's run like dozens of Ironmans, a couple of Ironmans. I don't know. She has completed a full Ironman at least once in her life and run many, many marathons. She was actually at the first ever women's marathon Olympic trial. And so she is all about getting things done. And she's like, she can't sit still. She's got to be doing something. And so she's already started a membership referral program to help members get involved. She's already started this lessons in a lunchbox collaboration, and has started a lot of action teams to look at things like third-party payers, and to look at things like, making sure that our graduating dentists have the career choices that they want, have access to the jobs that they want. So she's getting things done, and I don't think she'll sit still until her term is over next October.
I love that. I love that. I know. I sat next to her husband at the House of Delegates, and he was like, I just let her do her thing.
Yes. Yeah. Brian is the biggest cheerleader of it, Linda. He's like, she knows exactly what she wants, and I am just along for the ride. And I love that.
Well, I was looking at some of the stats of like 2021. I think all dental schools across the country, like 55% are now like female dentists, which for me, that's amazing. I think it's, we're great at collaborating. I think that we have different needs in terms of some of our, professional pathways, but I love seeing that representation, and, all about collaborating with our fellow dentists to, push our profession forward. I think that's so important.
Mm-hmm. I think there's also,
and yay, Linda's from Seattle.
Yes. Yeah. Yeah. I think
we're represented.
Yeah. Yeah. I love anything from the Pacific Northwest. Very much West Coast, Best Coast. I think there's also the Health Policy Institute. So ADA also does a lot of really cool health policy research. And I don't have this pulled up in front of me. So someone would have to fact check this, but I'm pretty sure they've done research that says that women dentists are more likely to take Medicaid, to serve patients who have difficult time accessing dental care, or to work in underserved communities and clinics. And so I think also more women dentists means more access to care. That's what the data shows. So that's exciting to me from a public health perspective too.
Hi there, I'm Dr. Tiffany Lamberton. I'm dropping in with a quick friendly note before we jump back into our podcast. Let's chat for a moment about mentorship. If you're a dental professional wrestling with TMD cases that you're really struggling to get it, I understand. The complexity of diagnosing, crafting those detailed treatment plans, and ensuring your patients are comfortable, it's a lot, isn't it? Here's the good news. You don't have to manage it alone. I'm here to offer a helping hand with my personalized one-on-one coaching and consulting services. Drawing from my rich experience in temporomandibular joint disorders, as well as my physical therapy background, I'm all about guiding you through these challenges with ease and confidence. Think of me as your personal mentor, here to bolster your TMJ management skills. Together in our sessions, we'll dive into the practical know-how I've gathered over the years. From strategies to helpful tips, I aim to streamline your practice and enhance your effectiveness. The best part, our sessions are super flexible and designed to fit right into your busy schedule. We'll focus on comprehensive learning, and that's not just about TMD, but also touches on improving patient communication and growing your practice. So no more feeling overwhelmed by TMJ patients and TMJ pain. With a bit of teamwork, you can boost your experience and confidence. Ready to take that first step? It's easy. Just swing by tmdcollective.com/VIP to book your first session with me. Let's team up to take your TMD management skills to new heights and really elevate your practice. Your path to becoming a TMD expert starts now. And now let's get back to the show.
Absolutely. Absolutely. What's your opinion? There's a lot of like new dental schools going in. We're getting a new one here in our state, in Yakima, and they're going to have a branch here in Tacoma that is going to be at an FQHC. I think it's really exciting. What are your thoughts?
Yeah, I love to see that experiential learning being incorporated more into the dental school models. I think I'll say that I think that as we train more dentists, we also have to be prepared to train more dental assistants and hygienists. And so I think that that's something that we're experiencing right now, we as a profession, and also me in my clinic, is that we can't do the work that we do to the best of our ability without our dental assistant and dental hygiene colleagues. And as the rate of dental school openings has progressed, we haven't stayed we haven't tracked with our colleagues training in dental assisting and dental hygiene. So I hope that conversation shifts and we start to look at the whole team instead of just training dentists, because we can't do our work without them. But I actually get the privilege of working with dental students on their external rotations in their fourth year. They come and spend 4 weeks with us in Medford. And it's really fun to see them experience what that is like. They gain so much confidence. They get experience with treatment planning. They learn what it's like to work with a dental assistant. They get a little bit of a time pressure to feel what an hour or half hour exam is like instead of a 3-hour or 6-hour exam. And so I think as long as there is training and support and calibration of the preceptors or faculty members at those satellite clinics and sites, I think it's really awesome to get dental students out into the community to experience kind of boots on the ground dentistry, and also to serve communities beyond just the urban centers where dental schools are located.
Yeah, I think it's an amazing model. Where I went at Loma Linda, we had service learning was part of the curriculum. You had to do that. And I'm such a big proponent of that. Here in Tacoma, we've had Project Homeless Connect. We've had dental clinics, give kids a smile. And, that's the part that, kind of like fills your cup again, right? as a professional and just being able to see, a tangible way to actually help someone who is in an underserved area. You get to do that every day.
I do. Yeah.
Yeah.
Yeah. Well, and I think that we do a really good job. I'll toot our horn for a little bit, but I think we do a really awesome job of getting patients connected to resources as well. So a story that I always really like to tell is that I had a patient come in. He was kind of irritated, knocked on our door right at opening, said, I need an appointment today. My tooth hurts and I need to be seen right away. And thankfully we had space in the schedule. We were able to get him in. But as we talked to him, we kind of asked more about why he was feeling the way he was feeling, why he was presenting kind of angry and upset. And he was able to share with us that he recently lost his home and he was couch surfing with some friends. And in that process, he had lost his cell phone. And so he didn't have a way to call our office and make an appointment. He didn't have access to a phone. And we hear this in so many different ways. I don't have access to reliable housing. I don't have access to food. I don't have access to, I can't afford a suit to go for an interview to get a new job. And we have community resource specialists embedded in all of our clinics that then we can connect those patients with those specialists to get them the resources they need. So this gentleman, we were able to get him connected with it's called the Lifeline Network, free basic cell phones and a kind of basic calling and texting cell phone plan. So he was able to get a phone back so that he could be in communication with his loved ones and also with healthcare facilities. We've been able to connect people with transportation assistance, with housing, with food vouchers. And so it's really neat that we can take care of patients in that full scope. And it's neat that we get to show students that in their rotation with us, because I think there's ways that anyone can do that. Even just having a flyer with the phone number for your local health department in your lobby can be helpful, or can get a person connected to the resources that they might need.
Yeah. No, I love that. And when I did Project Homeless Connect, I mean, I had no idea, just all of the resources that were available for all of those different, components, which, so I guess that goes back to like, get involved and then you like have your eyes open.
Exactly. Yeah. Yeah. And I've learned so much I like to think that some of my colleagues in different practice settings have learned from me, and I have learned so much from my colleagues in different practice settings. And so that's what I love about organized dentistry, and going back to that local meeting, like we all come together that one Thursday night a month, and we can talk about what's going on in our community. We can talk about what we're seeing in our offices, and we can get different perspectives and different experiences and different points of view to problem solve and to take really good care of our patients, no matter what office we're in.
Yeah. And then could you speak a little bit about the benefit from like a student loan perspective? Say I'm like a new dentist coming out of grad, school. I mean, I'm still paying for my student loans.
Yeah.
And I'm like 16 years out.
You'll get there. Yeah, I'm super proud I was able to pay mine off last December, so a year ago, which was...
I know, I saw your post on Instagram. I was like, that is amazing.
Yeah, and it was... So there's lots of different programs. Most of them are through the National Health Service Corps, NHSC. And so if you are a pre-dental student or a first or second year dental student listening to this, there are some scholarship opportunities to pay for anywhere between 2 and 4 years of dental school. And it works similar to the military HPSP program, where the National Health Service Corps pays for 4 years of your school, or 3 or 2, and you then owe that same amount of time, 2 or 3 or 4 years, working in a federally qualified health center like mine. You're not assigned like you are in the military, so there's some more choice in where you want to live and where you want to practice. And that is a full scholarship. So I know some students still have to take out a minimal amount of loans for cost of living, but it covers all of the tuition and fees and basic living costs for 4 years, which is a huge benefit. There is also the Students to Service program, also through NHSC, which I took advantage of. And so that you apply in fall of your 4th year. And I think the deadline was like today. So if you're a 4th year, and today is December 8th, and this will be released in January. So if you're a 4th year, it's too late. Sorry. If you are a 1st, 2nd, 3rd year that you think you might be interested in public health, but you want a little bit more experience through dental school and you want to try out some different things or shadow some offices or do your rotation, and then you can decide in the fall of your 4th year, you apply to the program. And if you're selected, you get $120,000 of tax-free loan repayment in exchange for a 3-year commitment to work in a federally qualified health center. So that's what I did. I got $120,000 that I was then able to put towards my loan payments. I graduated with about $280,000 in debt. So that was just under half of my loans forgiven. There's also the NHSC loan repayment program, which is a little bit different, that you actually get, you find a job, you make sure you like it, you're working in public health, and then you apply to the program and make a commitment for 2 years. And I think it's up to $50,000 per year or $40,000 in that range per year for 2 years at a time. Some states also have really good loan repayment programs if you're in an FQHC, or sometimes even if you serve a certain number of Medicaid patients. So there's different options. You can usually Google like your state's name and then healthcare provider incentive program, and that usually gets you to the information that you need for the state specific programs.
Awesome.
Yeah.
Well, tell us a little bit about, 2024. What do you have that's coming up that you're excited about or that you want to promote or, give a shout out to?
Yeah.
And if you have any information, we'll link it in the show notes as well.
Cool. Well, I'm just excited so I just finished up my 1st year on the new dentist committee, and it's a 4-year commitment. So I have 3 more years. And one of my goals is to attend a new dentist event in each of the states in the district that I represent. So that's Oregon, Washington, Alaska, Idaho, and Montana. And so if you live in one of those states and you're planning a new dentist event, please get in touch with me. I would love to learn more. I would love to meet you and just learn about the awesome things that you're doing. My Instagram, that's probably the easiest way to find me, is Alayna the Dentist. And so I think it'll be linked below. And so you can just find me on there. And so that's something I'm looking forward to. I think Montana's doing a great program in July that I think I'm going to go to. I'm going to the Oregon Dental Conference in Portland in April. And then I'm also really excited about the National Lobby Day. So we talked about the State Dental Action Day, and there's also a national version of that happens in Washington, D.C. each spring. This year, it's April 7th through 9th, I think. It's early April. And we want a huge turnout this year. We want to see a ton of new dentists. We want to see a ton of dental students and a lot of more seasoned dentists as well. And those are where we get opportunities to talk directly to national legislators. So your senators, your representatives. And we also get training on the lobbying process. And so it's a really cool way to see the ADA in action and to really experience what Dr. Lamberton and I have been talking about, that advocacy in action. So if you're going to Lobby Day, let me know. I'll see you there. I'm really excited about it. And I think those are the main things that stand out to me. I love the work that I do every day. So I'm excited to continue to serve patients where we do a lot of training. So we work with dental students. We also train dental assistants that come through our clinic. And so I love teaching. So I'm always looking forward to any opportunities to teach in my practice.
That's amazing. Well, thank you so much for sharing your expertise. I'm normally on the show. I talk a lot about TMJ and airway
Yeah.
and myo, but I wanted to kind of take a little break, and especially with like the new year, and just give that shout out to like what you do, and like I said, get involved in organized dentistry at whatever level that your comfort level starts with, because it really has opened my eyes, and I think it's so important to have that unified voice to push our profession forward. So
Yeah.
all you dentists, get involved, and dental students.
Exactly. Dental students, new dentists. And if you've been practicing for 20 years or 30 years or 40 years, we want you too. We'd love to have your perspective, because you bring so much wisdom and experience and hindsight. Kind of you can tell the story of how the profession has changed and where you want it to go in the future.
It's like a legacy, right?
Exactly.
Legacy talk.
Exactly. Yes.
Awesome. Awesome. Well, thank you so much for being on the podcast with me and sharing your expertise and your experience in this area. It's just been really fun to talk to you about this.
Thank you so much for having me. It's felt like a natural conversation, and that's the best, to just get to talk with other dentists. Yeah.
Absolutely. Absolutely. Well, here's to 2024.
Here's to 2024.
Thanks for tuning in to Jaw Talk. We hope you found this conversation enlightening and inspiring. Don't forget to support the show by leaving us a review, sharing it with your friends, or giving us a small paid subscription to the show on a monthly basis. Every little bit helps us continue to grow the show and create amazing content. Thanks again for joining us. I'm Tiffany Lamberton of TMD Collective, and this is Jaw Talk, and we'll see you next time.